Joining me now is pediatrician Dr. Dina Kulik. Dr. Kulik, your thoughts on this?
I think it's great. I think the more people that we can get vaccinated ahead of the start of the school year, the better. We know that vaccination works to keep COVID cases down. And given that so many of our kids can't yet get vaccinated because they're less than 12, more teachers, more administrators, more personnel in schools getting vaccinated will help keep our numbers lower.
What about pushback from some people who don't want to vaccinate at this time or don't want to vaccinate their kids, even if they're over the age of 12?
I think more education is better. So it's always best that people speak to their own healthcare provider. There's a number of different groups providing counseling on the safety and the effectiveness of vaccines. There's a lot of pseudoscience out there and mythical stuff and propagation of myths in social media and in media, but there's lots of truths to be told. And I think that the more educated we are about the actual evidence, the actual science, the more empowered parents and teachers can be in making a decision for themselves.
When might we see vaccines for the under 12 group become available? And would it help mitigate the rise of COVID cases to vaccinate those under the age of 12?
Absolutely. The more people that can get vaccinated, the better. We know that we'll likely need young people to be vaccinated to reach that herd immunity threshold where we'll have less COVID-19, circulating in the community. When that is yet to be found, really. So there's lots of investigation now, lots of research going on, looking at children less than 12 and how effective and how safe the vaccine is, the best doses, the best dose interval. That is actively being studied now, and we're meant to get some research published in the next, hopefully, couple of weeks to roll out the vaccine by fall or winter, we hope.
The TDSB trustees also voted to send a letter to the public health agency in the province asking to make the COVID vaccine added to the list of compulsory shots for students that are eligible. So, whether it's measles or rubella, even HPV, although that's not compulsory, I don't think. But you get what I'm saying. Is that the right way to go? And the reason I ask, doctor, is because if COVID is to become endemic, kind of like the flu, we don't make flu shots compulsory. So is that a false equivalence?
Yeah, they're not the same.
Okay.
Though, flu circulates each year, certainly the risk of dying or becoming very sick with the flu is far, far less than from COVID-19. Plus, we keep seeing new strains that are more virulent and more contagious and make people more sick. So it is a different kind of illness. Certainly, there are many families that opt out of those mandatory vaccines each year. So it's not mandatory per se. You can opt out, but the vast majority of Canadians do opt in for those vaccines, as they should. They protect us. We used to have outbreaks of tons of illnesses that are no longer really endemic because of vaccines.
Right. Okay. I really appreciate your time and your expertise. Thank you.